what is the metabolic impact of cancer on the body and what does that actually mean for a person. And really what it is it's the terrain, the inside environment, to make that environment inhospitable for cancer cells to grow and replicate is really important.
For having me in today, Katrina. It's awesome to be here to talk to you about the frequently asked questions that you tend to get regarding ovarian cancer in clinic. And one of the first things that we really want to talk about today are some of those alternative monitoring strategies that can go along with even the conventional monitoring strategies that patients may undergo through their recovery process. So can you tell us a little bit about those conventional strategies first?
Yeah, absolutely. So conventionally, a lot of people who've experienced ovarian cancer or have had the diagnosis, once they've gone through treatment, they'll do 3 to 6 month follow-ups with their oncologist. They'll also do pelvic exams sometimes, and there are even blood tests and cancer markers that they do to follow along to see if there's progression of the disease prior. There's a lot of controversy over using those blood markers, so you may not have heard of them or your oncologist may not be following them, and that controversy comes from the fact that there are some studies that show that if we monitor them too closely, that people will bring in intervention sooner and not necessarily have better quality of life and or longer life from doing that treatment earlier on based on those blood markers. So you can see the limitations that some of those markers can have. Naturopathically, there are things that we can do alongside them that really address the metabolic part of this disease. And so I talk a lot about what is metabolic, what is the metabolic impact of cancer on the body and what does that actually mean for a person. And really what it is it's the terrain, the inside environment, to make that environment inhospitable for cancer cells to grow and replicate is really important. And that is where we have a lot of work that we can do naturopathically alongside these conventional options for monitoring and maintenance and prevention. And so what we want to do is we really want to make that terrain non-inflammatory. And so there are some systemic inflammatory markers that I talk a lot about in the book that they're very inexpensive. They can cost $4 or $5 to do, that you can follow alongside, some of these blood cancer markers for ovarian cancer. And there have been some studies that have shown if we keep those markers under a certain range, that they actually increase disease-free survival and progression-free survival states. And that's really, really important. And so those two markers are CRP, C-reactive protein, and ESR, erythrocyte sedimentation rate. And you can see the big words. So that's why we call them CRP and ESR.
Awesome. And so there's also some other ways that we can look at inflammation within the body outside of just CRP and ESR. Those being obviously first, as you said, two very easy, accessible ones where we can really get a sense. But then there's also some ones that are a little bit more specific to monitoring cancer and can be used across a wide variety, but inclusive of ovarian cancer with some very specific targets. Can you tell me a little bit about one that you really love?
Yeah, so the one that I do a lot with patients is called the fibrinogen-albumin ratio, FAR for short. And that one helps us understand nutritionally what's going on. So albumin is a marker of how you're able to amass protein in the body. Fibrinogen talks a lot about clotting factors and whether all of the nutrients that are supporting those clotting factors are in balance. When you do the ratio, though, we've been able to discover that if we keep the ratio under 7.1%, that decreases the chance of recurrence and allows for ovarian cancer survivors to live longer in disease-free and progression-free survival states. And that's really what this part is about. So that is a lovely ratio that's easy, again, fairly inexpensive blood tests that we can do alongside. And we get this twofold process of understanding some nutritional, components on the inside, as well as being able to monitor that rate and really see that there isn't that state of terrain that allows for cancer cells to grow.
Mm-hmm. And I think one of the things you had talked to me about before as well is that with FAR, that can be a really great supplement to making people feel a little bit more confident compared to some of these other markers where there's a bit of controversy. So it's like we might be running that other marker for ovarian cancer, but because there's some question marks around it, this can let us actually have something that augments that understanding and can give patients a little bit more confidence in the things that they're monitoring. Is that right?
Absolutely. So what I usually talk to patients about is that there's always a percentage. Someone will come in and they'll say, oh, my CEA was 8 and last month and this month it's 12. And I'll go, okay, so it seems like a lot because it's jumped up 4, for example, and that's half of what it was before. But if we do these other markers alongside it, we can feel really confident that what we're doing is the right strategy. And we can look at it and go, that jump is actually not that big of a jump. If it went from 8 to 1,000, then we would go, okay, something really drastic has happened here. But to be able to be more confident that even those small bumps in those numbers, when they go up and down, a lot of patients need to develop that confidence that what they're doing is working. And that fear can really hold them back in terms of changing their life, transforming from survival, or feeling really confident that they're able to not live in a place of fear on a daily basis. And that empowerment really helps them with that next step of transforming survivorship.
Yeah, absolutely. And I think that sort of nicely ties into the fact that we also have a number of maintenance therapies that are happening, again, both like within the oncology realm, but also things that we can be doing within the naturopathic realm to help patients, again, have that better confidence as well as better outcomes in terms of their survivorship. So let's talk a little bit about some of the maintenance therapies we commonly see with ovarian cancer.
Yeah, so more and more there is something called a PARP inhibitor. It's a really big word, and I'm going to have to look on my page to tell you it. Poly-ADP ribose polymerase inhibitors. So we'll call them PARP inhibitors for short, and they are becoming more commonplace. And their purpose is to actually infiltrate a space where ovarian cancer, especially hereditary connected ovarian cancers, have, so that we can reduce the risk of reoccurrence. And they're wonderful. They are wonderfully new, kind of new drugs. They're not new, but they are newer, right? And becoming more commonplace, as I said. But unfortunately, they do have a lot of side effects. And one of the big side effects that patients can see is that if they haven't fully recovered from their original treatment in terms of radiation and chemotherapy treatments, it can actually continue to lower the platelets, the white and red blood cells. And what that means is that you become more fatigued, right? You stay in that anemic state, have more difficulty with clotting, so lots more bruising and bleeding. And then physically, you could also be a lot sicker because those white blood cells are more compromised. And so you can end up with lots of sinus infections and different infections and things like that. And so that's really important to be able to monitor. Now, conventionally, they will monitor them while you're on these drugs, but how do we get our body to be able to continue to take these drugs if we feel that they're really warranted, as well as not have these side effects? And one of the things that we know is that if we maximize those nutritional values like the vitamin D and vitamin E, we can actually have a big impact on those lower levels of platelets. For example, platelets can use vitamin E, and if you're vitamin E deficient, then it's hard to continue to build those platelets. White blood cell counts, if they're lower, vitamin D can help the body to continue to build that immune system and be able to fight off those pieces, that are going on. Iron is another deficiency that could help, or B12 or folate could help that deficiency in those red blood cells. And so finding those alternative, tests that we can monitor and keep in optimal ranges can reduce the risk of those side effects.
Mm-hmm. And outside of side effects, I think the other thing too is that it lets people feel better on the medications longer, and therefore allows for that medication to be continued in their regimen without them feeling the need to potentially stop because it's decreasing their quality of life so dramatically.
Absolutely. And so one of the things is that we do naturopathically, or one of the things that we can do when we're considering all the other parts of this, is making sure that you are still a candidate for that therapy. Getting those numbers so low that you no longer become a candidate can feel really disempowering and challenging because there's a lot of fear around not being able to take that medication. Mm-hmm. So a lot of patients will ask me, how do I make sure that I can continue taking it? Okay, so that's one of the things that we look at to work alongside that maintenance therapy specifically.
Yeah, I think the other thing too that can be very common both with PARPs and other types of medications is that people can experience brain fog as a significant side effect. And so can you tell me a little bit about that specifically for your ovarian cancer patients and how that tends to impact them?
Yeah, so the blood work that we just talked about, the anemia and those types of things, sometimes sometimes people won't even know that they're happening, right? Until they go and get their blood tests and they get checked up on the follow-ups. One of the things that a lot of my ovarian cancer survivors see is brain fog associated with these medications. It's the thing that they notice the most. They struggle with daily life and decision making, remembering, significant events or small things like what they ate today. It can really impact them because they also can't remember if they took their medications that they need to take or their supplements. And so this brain fog is something that we really want to connect with for patients. And so what I do for patients that are suffering, that are on the PARP inhibitors, is we look at breaking down the nutrients and making sure there aren't any nutrient deficiencies. One of the other things is when we're using that albumin ratio, making sure that our proteins are high enough, because protein can be a part of brain function and having that brain fog. And then the second piece is making sure we have good fats in our body, right? So omega-3s, phosphatidylcholine, these are things that really help the brain to be able to function on a more regular basis, knowing that the brain is basically a big fatty tissue and it needs those recovery pieces. And so those are 3 steps that I would start to deal with the basics of brain fog that can come secondary to an intervention like a PARP inhibitor. Yeah.
Mm-hmm. Fantastic. And now I think the other thing that's really common that you do get some questions about that you shared with me is some of the impacts on body confidence that people can face post-cancer in general. But definitely there are some specifics when it comes to ovarian cancer. And I think one of those big ones is the fact that many women are actually going to face a total hysterectomy, meaning that their uterus and their ovaries, especially with ovarian cancer, are actually fully removed. And so can you tell us a little bit about what that means for patients and how it tends to play out as a consequence?
Yeah, so hysterectomy, there are women who get ovarian cancer post-menopause or women who get it before menopause. And so the categories don't differ in the sense that once you've removed those organs, there are some physical changes that you need to address. Taking those organs out is great in the sense that we're removing the cancer, but also creates this space where there is a possibility of developing prolapse. There are pelvic floor dysfunctions that can start to happen, and that can really impact body movement. It impacts body confidence, and that really has a role to play. So there's scar tissue that gets built up there, because we've removed those organs. That pelvic floor dysfunction can become intense. It can affect urination. It can affect, like I said, body movement. So exercise. It can affect actual going to the washroom number 2s, right? So bowel movements and functional constipation. Sometimes patients will come to me and say, I've never had this problem and now I'm having it all the time. And part of that is because the pelvic floor has dysfunction. And so the first thing that I always tell patients is, and this is not something that happens during the cancer process, but in this cancer recovery space, getting a pelvic floor physiotherapist to be able to help you address and assess what's actually going on in the pelvic floor is really, really key to moving forward. Finding a pelvic floor physiotherapist that knows about, post-cancer recovery is very important as well, but they should be able to actually give you hands-on treatment, hands-on connection to actually be able to find out if you're too tight or too loose, or if there's scar tissue that's in the way, and how to be able to keep moving forward in terms of that recovery. And so physically, there's that part.
Mm-hmm.
Yeah.
I think the other thing that can be secondary to some of those physical elements, but can also obviously be happening from a mental emotional perspective, is libido changes, right? And also impacts in terms of just vaginal functioning, as you were talking about. In some cases, we may actually have spasticity in the muscles, and that could make things like intercourse uncomfortable. But the other factor is things like lubrication, because as you alluded to, women sometimes get launched into menopause, or they get reintroduced to a menopause-like state due to some of these medications, but also due to just the surgeries themselves. So how do we address some of that sort of intimacy and libido work with our patients? Yeah,
so a huge factor for body confidence is to reconnect with that. For a lot of people that have gone through ovarian cancer. And the reason that that's so important and vital is because that's how we can connect with other people. So yes, there's an intimacy connection, so we don't feel isolated. There's also a loss of who you are. It's like going through puberty all over again, essentially, but with worse symptoms, because we're just developing and understanding who we are now in this strange body and in this shape. And so one of the things that I do is that there are different steps, right? So we look at it and go, okay, so we've seen the pelvic floor therapist, or maybe we haven't. First step, understanding what's going on down there. Second step is, what are the limiting factors, right? And so is vaginal dryness a big issue? For ovarian cancer survivors, it is very highly likely that some sort of vaginal dryness is a concern. And so there are some therapies that we can use, and some basic ones. There are non-hormonal based moisturizers. There's one all-natural one called Demiva that I love, that's specific, that they've made specifically for women that have gone through this place of menopause and post-cancer recovery. And then there's also another one called Gynotrope that's really great as well. They are non-hormonal based ones that can be used repetitively every day just to make it more comfortable even to urinate or even to go to the bathroom, let alone also being able to participate in intimacy and libido changes and sexual, connection with our partners. So that's the first thing, is finding a good moisturizer. And there are some women that isn't good enough. And so then they will also go into another like laser therapies or other types of treatment to be able to manage that. I always tell patients when we're dealing with this vaginal dryness that it also is the internal part, that metabolic terrain thing. And so making sure we have enough lubrication of our skin tissue. And so that's omega-3s. It's the vitamin E that we were just talking about. And it's about hydration as well, because we can't just imagine topically to apply these things without the internal environment also supporting that. And so it's working on the inside and the outside, and then of course connecting with a physical therapist to actually understand what's going on with your pelvic floor.
Absolutely. And I think that's probably one of the key things that I would absolutely agree with, is that we really want to use our allied professionals in this process, because they can be such a huge help. And I think another way that we often can rely on our allied health professionals is also looking at how our bodies change. Sometimes we've had significant weight loss or muscle mass loss, or in some cases people experience weight gain because some of the treatments have a hormonal implication. So what are your top 3 tips for helping people who are experiencing these changes in their body mass and how to overcome that post-ovarian cancer? Yeah,
so the first thing, and it sounds really silly, but letting go of the traditional model of like calories in, calories out, stepping on a scale, monitoring. These things don't work for cancer survivors because their body has ultimately been changed. And so we have to let go of some of those specific nuances in how we're connecting with these things. It's about rebuilding our body with where it's at. And so understanding where it is now, because it is a very new shell that we're working with. And so that's the first thing I do. Throw out the old school stuff. It doesn't work, right? Yes, there is some nuance to quality and quantity of types of foods, and we want to make sure you're eating enough, because a lot of people believe that starvation is a part of weight loss. But I'm here to tell you that if it is weight gain that you're dealing with post one of these types of treatments, especially ovarian cancer, calorie restriction is not going to work. It's actually going to hinder you and backfire. You may lose the first 5 to 10 pounds, but you'll plateau and eventually gain it all back and more. And that's not what we want. Long-term strategies include supporting our body where it's at. So that's the first thing, throwing out the conventional models of weight loss. The second piece to this is actually dealing with stress. Stress factors are huge. And a lot of people will say, oh, it's just my stress. And I'm like, great, but how are we changing it? And so I really refer people back to the book in terms of the chapter on stress and understanding where their stress survivor state is at. Because if you understand where it's at, then you can understand the interventions to help recover from it. It's not about just becoming not stressed or sleeping more or any of those types of things. It's actually about understanding a step-by-step process to get out of that stress state. So that's the second piece that I work with. And the third piece is I usually suggest people to really find a nutritional plan that works for them. Understanding whether they need carbohydrates, whether they need more proteins, because everybody is different. It was different before cancer, and it's even different after cancer. And I use a personal example. I am not a carbohydrate great person. So having rice, for example, on my lunch, that's going to make me tired and sleepy and actually make me gain weight. Whereas I'll do better if I use a little bit of beans, and a little bit of meat that works for me, and all of the other vegetables that work instead. And so understanding what it is that your digestion and how your body works, and I could go on and on about this. There are genes that we can connect with. There are nutritionists, and so really finding a partner to figure out your nutritional strategy that isn't versed in one trick. And what I mean by that is that a lot of people will give everyone the same diet and say that it works, and that to me is garbage, because you didn't come into this being the same as everybody else, and you definitely didn't get through it being the same as everyone else. And so finding a person that's able to understand how your nutrition and body works, and they spend time getting to know what you like and what your strategies are, is very important to making that nutritional strategy and making sure you're getting enough protein from all the sources that make sense for you.
Fantastic. So I think we've covered these really important topics today regarding ovarian cancer. So we've reviewed those amazing additional preventative markers that we can look at. We've looked at the various maintenance therapies and, of course, how we can address body confidence. So we hope that this has been helpful for everybody, and we look forward to seeing you all on our next video.
Yes, thank you very much.